There's Bernskoetter.
Here.
Present. Searpoy. Present. Beck. Present. Black. Present. Bratton. Huff. Razor. We have a quorum.
We do have a quorum. I think I was a little too aggressive maybe when I put all these bills up for hearing, but we're going to quickly go through them, so be as brief as possible this morning. I will have to leave around 8:15, and I will turn it over to Senator Serpoy. I have a bill that I'm presenting in another committee, but is Senator Representative Coleman here? Okay. All right, please come forward. We'll do the HJR 33 and 45. And please fill out a witness form. If you've never done it before, fill out a form and leave it on the desk when you get done. Thank you. Go ahead, Representative Coleman.
Good morning. Good morning. And thank you. I thought I was going to be last today. Thank you for hearing our... No, I'm good. Thank you. Good morning, and thank you, Mr. Chair, and to the committee members. HJR 33 and 45 came together this year. I've been working on 33. This is my fourth year, and it started with us having a special committee 4 years ago for the local taxes. This issue came out because out of all the local taxes, this was the one that we heard the most on, that people were afraid of losing their homes. So what I did is I put together this language. There's no special interest groups behind it. This is not a partisan issue. This is a human issue where it really benefits both the low income and the fixed income. And what it does is it limits the county assessors to 2% per year or CPI, whichever's lower. I see that face. And let me explain the reason I did that. I know it sounds low, but the fact is that I've been on school board, because that's one of the issues that people think about. This does not take away anything that any of the municipalities are currently getting. They still get the same amount that they got last year, the year before. The only thing it does is limit what they get going forward. And as far as the limit, the reason I picked 2% is because if they need more than what they're getting currently, or that the 2% per year or 4% every 2 years gives them, they can go to their constituents and ask them for an increase in their tax levy. That's called taxation with representation. It's not a matter of taking away what they're getting. They can still get it if they need it, if the people allow it. And I think that's where it really belongs. So what it does, again, it limits them to 2% per year. The way it works is that whatever their value is on the day that this passes, this is just language. We don't get to make this change. The people have to make it. So if they pass it, if it gets to the ballot, then whatever their value is on that date, that becomes their base, and that's what they get as far as moving forward the 2% on. From that point on, for new construction, meaning if you do anything that changes the value of your house while you're in it, the only thing that happens there is the cost of the materials is what increases the value. And once again, from that point on, it's 2% limit. If you sell your house, whatever the value of your house is at the time, whatever the sales price of your house is, that becomes a closed document. It goes from the title company to the assessor's office, and because it is a constitutional issue, It can be a closed document and nobody can get to it. I've checked this out with the Attorney General's office. So at that, I've talked to the realtors. They're staying back. They were originally against it. They are staying back at this point in time. The schools don't really have an issue with it at this point. They may say that there is, but they're not opposing it to this point. So we should have smooth sailing with it as long as you approve of it. So with that, I'm going to pass it over to the other gentleman, unless you have questions about this portion, because at age 65, we go to a different section.
Okay, thank you for your testimony. Any questions? Seeing none, thank you.
Thank you, sir.
Anybody come forward, testify in favor? I remind you, please be as brief as possible.
I will be very brief, and I think I'm Ben Keithley, District 101, West St. Louis County. I'm the sponsor of HJR45. I don't think it demands too much explanation at this point because this committee has essentially already heard it. HJR45 started out as very similar to, our HJR45 started out very similar to SJR33, which was filed by Ben Brown and already passed previously out of this committee. It now is represented basically by lines 48, I think it's 48 through the end, 68 in this HJR in front of you now. The main difference being that the exemption for assessment increases for seniors is no longer defined like in Senator Brown's bill. At Social Security earning age, it's now defined at 65 to keep a clean age cap. But that is probably the most substantial difference in the language, but I'm happy to answer any questions regarding it. Otherwise, it's very similar.
Thank you. Any questions? Seeing none, thank you. Anybody testify in favor, please come forward. Anybody testify in opposition, please come forward. Anybody for informational purposes only? Seeing none, that concludes the hearing on HJR33 and 45. Representative Wright, will you please come forward?
Thank you, Mr. Chair, and thank you, members of the committee. My name is Dale Wright. I am representative from the 116th District in the House. I'm here today to talk about a program that helps patients with their prescription drug costs, specifically high-priced drugs. In the past, we've had manufacturers of pharmaceutical organizations give vouchers or coupons to people who are especially on high-priced prescription drugs. This would help them meet their co-pays and their deductibles and their insurance. And so that's been a real help for them to be able to afford that, and it helps them to make sure that they take their medications. Many of these are life-saving, life-maintaining prescriptions. Well, fairly recently, insurance companies have created something called accumulator adjustment programs in their policies. And what that does, it prevents the patient from using that voucher or that coupon going towards the co-pays and the deductibles in the insurance program. To give you an example, let's say you're on a $1,000 a month prescription and you have a $7,000 deductible that you must pay, and let's say the manufacturer or even an angel organization or a church or someone else gives you a coupon or a card to pay for that, to meet that deductible, you could use that towards that. Let's say it's a $4,000 coupon. You could use that, and then the patient would pay the remaining $3,000. Well, with these accumulator adjustment programs with the insurance companies, they now disallow that, where the patient now has to pay the entire $7,000 deductible. In many cases, this has prevented patients from taking their medications, or they're even splitting their pills in half just to try to make it last. So it's been a real challenge for some of these folks to be able to do that. So with that, in my opinion, Mr. Chair, the insurance companies really shouldn't care where the money comes from. Money is money, whether it's a check, cash, a credit card, or a voucher. It can be spent either way. And with that, I'd be glad to take any questions.
Thank you, Representative Wright. Any questions? Seeing none. Anybody testify in favor, please come forward.
Good morning. My name is Bridget Tyree. I'm the Executive Director for Gateway Hemophilia Association. I'm also part of the Missouri All Co-Pays Count Coalition, representing 25 patient organizations. Thank you for the opportunity to testify today. For individuals living with rare and chronic disorders like hemophilia, diabetes, MS, cancer, many more, the cost of treatment has a direct impact on patient access. Many patients and their families rely on copay assistance programs to afford their medications. They need to manage their condition. So, for example, my son has severe hemophilia. His medication's about $30,000 a month. So in January, it's a monthly, he orders medication monthly. He calls in January, he orders his medicine through the specialty pharmacy. They say, you haven't met your max out of pocket, it's $5,000. He says, I have a copay assistance card. They apply his copay assistance card, he gets the medication delivered to his house. He calls in February, I need my medication again. He's gone through the step therapies, he's gone through pre-authorization, the cost of drugs that is set. In February, they say, well, you haven't met your out-of-pocket deductible. He says, yes, it's $5,000. I met that in January. I used my copay assistance card. The specialty pharmacy says, oh, the insurance company, they took that money, but now they want it from the patient. If you're going to take it, don't take it twice. You're taking it twice. Take it, but don't take it twice from the patient. You're going to hear today, it's the insurance companies that are against this bill. They think we should have skin in the game. We're born with hemophilia. We weren't chosen. Cancer, we have skin in the game. They're going to tell you that it drives up cost. Cost of drugs, we all agree. The cost of drugs are expensive. That's a federal issue. That's nothing we can today solve on a state issue. We can have patients have access to their medication, their life savings medication. This. They say when patients they can't meet the out-of-pocket, adherence go down. When they have access to their medication, they have a 20% life expectancy. It leads to 1 to 3% better outcomes. 96.3% of these patients that use these programs don't have a generic alternative. I left handouts for you that talk about the myths and the facts. I left the handout that shows you the 25 organizations that are behind this. Again, you're going to hear from insurance companies. I'm here to tell you the patient side, the mom side, the executive director side. So today, I ask that you support House Bill 442 that requires all copays count towards a patient's out-of-pocket deductible. Whether it's from drug manufacturers, charities like Gateway Hemophilia, a church, a family member, it's critical for patients with chronic conditions. The sole purpose of this bill is to allow patients to have access to their higher cost medications. We understand broad-scale healthcare changes takes time, but patients wait. They cannot wait. We hope you'll put patients first and ensure all copays counts. Thank you for your time, your consideration. I'm here to answer any of your questions.
Thank you. Questions for this witness? Seeing none. Thank you very much.
Thank you.
Next in support, please come forward.
Good morning. Thank you for the opportunity to speak today. I'm in support of House Bill 442, which ensures all copays count. My name's Angela Brown. I live in Ozark, Missouri with my husband, Matt, and our 4 kids, Myra, Katie, and Jasmine, and Spencer. Severe hemophilia is part of our family. My hemophilia story actually began 35 years ago when my younger brother, at the age of 9 months, was diagnosed with hemophilia when he bumped his mouth and the bleeding would not stop. Many tests and treatments, they finally found a diagnosis, and he was the first in our family that we have hemophilia. I remember the fear and worry that my parents experienced during the years of him growing up to find medical care and access to his medication. And I also recall the financial strain caused by this medicine that was life-saving. Spencer, our oldest son, was diagnosed with severe hemophilia after he nearly bled to death from his circumcision. Although he was diagnosed within 24 hours, he was in the NICU for over 2 weeks before he received this medication called Factor to stop his bleeding. Treatment for bleeding disorders was much different from my brother than it is today. For my son, on-demand treatment was the protocol for my brother growing up, so he's experienced a lot of pain, joint issues, muscle issues, bleeding internally. Prophylactic treatment, or medicine administered preventatively, is now the standard of care, and we appreciate that. Cryoprecipitate was the only medication available for my brother, while longer-lasting factors is now available for my son. My brother, who has limited mobility due to poorly treated bleeds and not on-demand, or just on-demand treatment, cannot fully extend his elbows and has ankle that has been fused. My son, however, because of his access to treatment and care and his medication, lives a pretty average life. In fact, you probably wouldn't even know he has hemophilia. He only infuses himself to prevent that from happening. He doesn't experience joint damage. The difference in their treatment speaks volumes. One thing that hasn't changed about living with a bleeding disorder is the constant worry and fear that we will not be able to afford or have access to our factor medication. The struggle has continued and to keep up with the rising cost of insurance related to that. We are very fortunate to currently have access to the proper treatment for hemophilia and adequate health coverage. But even with this coverage, my family's deductible is $9,100 per person. Each year we reach our deductible and out-of-pocket expense maximum when we order his medication. There are no low-cost or generic alternatives. Copay assistance has and continues to help us when we need it to cover the large costs in the beginning of the year so we can continue to access the treatment Spencer and my brother and other people living with bleeding disorders needs to stay healthy. If our copay assistance did not count towards our deductible and out-of-pocket maximums, my family would be forced to come up with the $9,100 in the beginning of the year or potentially forego treatment, ultimately experiencing additional health issues or health care costs. Even for the most fortunate of families, this is a large bill to pay. So I respectfully request the committee to support House Bill 442 to ensure Missourians with chronic health conditions like my son and my brother access the care they need by ensuring that all copays count. Thank you. I'll take any questions.
Thank you. Any questions? Representative Bratton, go ahead.
Thank you, Mr. Chairman. I'm so sorry to hear how this has been a family, an unfortunate family journey. Now, as for the costs on just overall medical care, have you seen was there a particular time frame to where all of a sudden it became so outlandishly expensive, or has it always been that way, or has it in the past, since an unrolling of a certain, Obamacare, I guess, so to speak, where all of a sudden our deductibles went to where it's almost $10,000 a person? Has that been where you really saw this dramatic increase in costs, or has it always been that way?
Not particularly for the cost of the medicine, no. The cost of the insurance premiums, that sort of thing, has just gradually risen with cost of living, kind of comparatively.
Okay. All right. Thank you.
Thank you for your testimony. Any other questions? Seeing none, thank you. Anybody else to testify in favor, please come forward. Like I mentioned before, let's be as brief as possible. I know this is a complex issue, but let's be brief. Thank you.
Thank you for the opportunity to testify in favor of House Bill 442. Emily Kalmer with the American Cancer Society Cancer Action Network. Similar to the experiences you've heard from the hemophilia groups this morning, many cancer patients and individuals living with chronic medical conditions have difficulty affording the costs of their prescription drugs. This is especially true for newer drugs like oncology drugs that do not yet have a generic equivalent. So this legislation is simply ensuring that copay assistance programs, whether they be from a manufacturer or from a charity or any other payments that are made for patients, actually benefit the patients the way they're intended by counting toward their overall out-of-pocket maximum or deductible. Just a couple of things to anticipate some things you'll probably hear. Some folks will say maybe this will lead to rising premiums. 16 states and Puerto Rico have already passed similar laws, including 5 of Missouri's surrounding states, Arkansas, Oklahoma, Tennessee, Illinois, Kentucky. There's no evidence of insurance premium increases in those states by similar legislation. As far as whether this would steer patients to particular drugs, these drugs already have to be prescribed by the doctor. The patient has to qualify for the assistance program, and the insurance company can already use their utilization, their step therapies, any of the existing ways they manage drugs right now before this. This is just when the patient has some other form of assistance to help them afford the cost of the drug that the insurance company is now saying you can't count that toward your out-of-pocket costs, and the patient essentially is not getting the benefit of the full assistance, and the health plan is getting paid twice. So those are just some anticipations of some things you're probably going to hear. There are 24 groups in support. I think Bridget already gave this, but just wanted to share the cancer patient and cancer group perspective. Thank you.
Thank you very much. Questions? Senator Serpoy?
Thank you. How does the insurance company know that somebody's helping somebody pay for their drugs?
Well, so sometimes it's a pharmaceutical assistance program, and there is something that they give to the pharmacy to cover that drug.
The insurance company's giving that?
No, the patient may have some pharmaceutical manufacturer assistance for the drug, and that is noted at the pharmacy. So I believe that's how they are aware. I don't know all the inner workings of insurance companies, but maybe they can tell you how they know that that works.
Thank you.
And there may be someone else who knows.
Any
the
other
answer.
questions? Seeing none, thank you.
Oh, and also I want to thank Senator Beck. He did sponsor a Senate companion bill. Just wanted to acknowledge that as well. Thank you.
Thank you, Senator. Any other to testify in favor? Please come forward. State your name and go ahead with your testimony.
Good morning, gentlemen. My name is Karen White. I have Chris Stewart with me. We're going to try to expedite this testimony, and as we both represent federally qualified health centers in the state of Missouri. I serve as the CEO of Missouri Highlands Healthcare. We are in 7 of very rural southern counties here in Missouri. Very beautiful, but very much poverty-stricken. Last year, we served over 25,000 patients, and we exist to serve folks who really and truly have no other options when it comes to health care. One of the key pieces of what we do is providing the 340B program for our patients. What the 340B program does is it provides pharmaceuticals at a low cost, slightly above manufacturer's cost plus dispensing fee, plus a few admin fees tossed in there at the local contract pharmacies. Without that program, the 25,000 patients that I serve, probably a good, I would say at least half to 2/3 of them would not have that option. Drugs are expensive. Folks cannot afford them. Many of our folks are either uninsured or, as we like to say, underinsured. They have extremely high premiums that they cannot afford their drugs any other way. And so we are here to testify in support of House Bill 442.
Good morning. My name is Chris Stewart, and I am the CEO of Katy Trail Community Health. We are in West Central Missouri, also a rural area. I'm testifying in support of 442 because this bill would affect really all health centers in the state of Missouri. We've been a community health center since 2006 and a 340B covered entity since 2008. We also provide primary care, mental health, oral health services in 5 locations, school-based locations, and then 4 other school-based services. We served last year about 15,655 patients, and about 90% of them were in low-income households. We employ 156 people. We have 15 primary care providers, 7 oral health providers, and 10 mental health providers. I'm testifying in support of this bill because we receive revenue from the 340B program that we reinvest into our organization in order to expand access to the very people that we serve. There are certain things that we have developed in our region that don't have any other funding. And so the mission or the purpose of the 340B program is to use that revenue that entities receive to provide care to underserved and underserved people. So I just want to give you a couple of examples of things that we've done by using these dollars. We started providing mobile services in Warrensburg to homeless people. Warrensburg has a growing population of homeless, and we go over there once a week and provide comprehensive services to that homeless population. We also use 340B revenue to provide services to the incoming Ukrainian refugees into Pettis County. Pettis County had an existing Ukrainian population, and so we are I would say a hotspot in Missouri for Ukrainian refugees. And we set up services in Ukrainian churches and provided comprehensive services to people who came over pretty sick. We also set up a site in Ivy Bend. I don't know how many people know where Ivy Bend is in Morgan County, but Morgan County, Ivy Bend is an incredibly isolated area where most people don't have transportation. And we set up services there without any other funding except for the funding that we received through 340B. So in 2021, we received just over $1 million in 340B revenue. In 2022, we received just over $800,000, which is a $200,000 decrease. And that is all the while we saw 800 more patients in 2022. So it wasn't a reflection of decreasing patients. That decrease was a result of the actions of pharmacy benefit managers and pharmaceutical companies. Our mission is to provide care to the most vulnerable people in our communities. Please support us by supporting this legislation.
Thank you. Any questions? Senator Serpoy?
I just want to make sure, so most of your clients, now that Medicaid expansion has occurred, have Medicaid. Is that true? These low-income folks you're talking
Yes, most of them, but not all of them.
about? Okay.
There are, I'm going to say about 15% of our patients are still uninsured.
Okay, thank you. Thank you, Chairman.
Any other questions? Seeing none, thank you for your testimony. Anybody else testify in favor?
Good morning. My name is Anna Meyer. I'm here to, on behalf of the National Multiple Sclerosis Society and Missourians living with MS. The average cost of disease-modifying therapy for multiple sclerosis is around $98,000. Because of that, around 70,000% of people living with MS have relied on copay assistance at some point in their diagnosis. And most people are diagnosed with MS in their 20s, 30s, or 40s, so there's decades that they're on these treatments that are on average $100,000 a year. There are 11 of those treatments that are over $100,000, and only 3 of them have generics. With copay accumulators, this extends their deductible period. They can't access their medications during that time until their deductible is paid. They also can't access MRIs, doctor's visits, rehabs, therapies until that deductible is paid. So people are putting off this treatment for months until their payments are accepted, even if they've had their copay assistance applied and it hasn't counted. Prolonged access to the medications and these treatments leads to relapses. It leads to lesions on the brain and spine that can lead to worsening symptoms, including permanent disability. So extending these deductible periods is not just a short-term problem for them, it's a long-term permanent issue for their life and their quality of life. So allowing all payments, including copay assistance, to count towards a patient's out-of-pocket and deductible will help patients now. So please support this bill to make all copays count.
Thank you. Questions? Seeing none, thank you. Anybody else testify in favor?
Mr. Chairman, members of the committee, Rob Monsess from Missouri Hospital Association. I'm here to dispel a few myths briefly. One myth is that the 340B provisions on this bill are too broad and will kill the bill. That is not true. 21 states have acted on 340B and passed the same kinds of protections that are in this bill, broad protections that protect both hospitals and federally qualified health centers. 4 of those states border the state of Missouri. There are 3 states that, including, and Missouri would make the 4th, that are pending to pass these kinds of protections. They are vital for hospitals and the federally qualified health centers. I've got some information I've shared with many of you about the differences between the cost of medical care and the rising costs of premiums and deductibles for the constituents that you serve. To get to the question I'm sure that we'll hear about, this will cause more costs for insurers. We have a couple of subject matter experts from the hospitals behind me that can answer detailed questions on the hospital side for 340B. I'll let them talk and appreciate your time. Please support 340B for hospitals. Thank you.
Senator Serpoy? Senator Serpoy, go ahead.
I'm just trying to, so 340B, if I understand it right, is something that the pharmaceutical companies take part of their profits, send them out to the states, I guess, to offset the cost of these drugs for low-income folks?
That's close, but not exactly how it works, Senator. So what it is, it's a federal program started in 1992 that says the pharmaceutical companies will sell certain drugs at a discount to providers. So they don't send the profits out, but the hospitals and the federally qualified health centers, any covered entity, gets to dispense those drugs at a steep discount.
Okay. And then the insurance companies are not allowing the consumers of those drugs enjoy that discount?
So the reason for these laws, the reason 21 states have acted on this, is that the insurance companies have started to discriminate against the 340B providers and are trying to take the federal congressional benefit, the federal law, and take that benefit for themselves instead of having the benefit apply to
And the
providers.
feds haven't done anything to prohibit that?
Pardon?
The feds haven't done something system-wide to prohibit that?
There is legislation to address this, but it has not passed.
Okay, thank you.
Any other questions?
Thank you.
And testify in favor.
Mr. Chairman, members of the committee, Jorgen Schlemer on behalf of the Missouri Pharmacy Association and Missouri Primary Care Association, I want to address 2 items. One was Senator's question on how do the insurance companies know what voucher amount you're bringing into the pharmacy. So when you come in with your prescription, you hand it to the pharmacy, the first thing the pharmacy does is they type in all of your information. It immediately hits the insurance company's computer system. It comes back within a half a second on the pharmacy screen, and the pharmacist has to put in there first if there are any coupons or vouchers or so forth, and you adjudicate that portion first, and then it comes back of how much of an additional copay the person is due to the pharmacy. So that's how they track what members have used, what vouchers, and so forth. Second piece is on the 340B. Missouri Primary Care Association very much in favor of that piece. Mr. Monsess did a fantastic job. The 340B discount, when it goes to the entity, so I'm going to say for an FQHC, instead of buying that drug at $100, they're buying the drug for $60. The $40 difference makes no difference to the insurance company. That is just a discounted rate to that clinic, so then they can dispense the medication either free because they bought it cheaper, or they can dispense it at a discounted rate. And unfortunately what's happening is you have 2 different provisions, one of which Mr. Monsess talked about was the discrimination piece. The other piece is called the pickpocketing, where the insurers have figured out a way to pocket the $40 discount that the provider should be getting and giving to the patient, and instead is wandering over into the insurance company's pocket. That's what this piece will help prevent. And Senator Searpour, you're exactly right. Federal government doesn't seem to act very quickly these days, and so states have kind of taken matters into their own hands. Now, before I totally throw the insurance companies under the bus, I will also say that at least from, Missouri Primary Care Association on the 340B issue, they have been working with us, and we appreciate that and hope to get to a resolution with them.
Thank you. Any questions? Seeing none, thank you. Anybody else testify in favor?
Good morning. My name is Mariah Hallbaugh. I'm the Director of Pharmacy with Citizens Memorial Hospital in Bolivar. CMH, like many other hospitals across the state, relies on 340B to provide critical healthcare services to our communities. In my role, I oversee pharmacy operations and 340B program compliance for our organization. HRSA has a very complex set of rules and requirements to determine 340B eligibility, and at CMH we run our entire team that manages our 340B program through a complex training process and the 340B University by Apexis. We have a rigorous audit schedule and invite an external auditor to review our program annually. We utilize specialized software to manage qualifications, drug inventory, and invoices, and report all of our data through a compliance committee at our organization quarterly. The administrative burden of the program has grown substantially in recent months as manufacturers and insurance companies demand more data and require system modifiers that in many cases are just not possible at the time the drug is dispensed. CMH is committed to being a good steward of the program and continues to identify unmet needs and innovative new services to reinvest 340B savings in our community and workforce. The 340B program has helped cover the gap between payments and the rapidly increasing costs for supplies and healthcare workers needed to provide these services. 340B doesn't cost the government any money, and the discounts provided by manufacturers represent a tiny share of their huge profit margins. When insurance companies siphon off 340B savings, it makes it even more difficult to maintain our existing services. Like you've heard already, CMH uses 340B savings to reinvest in our patients and has provided over $1 million in the last year to patients through our drug discount program. Because of 340B, we offer extended walk-in clinic hours and emergency services in our rural communities. Because of 340B, patients have access to comprehensive specialty services and obstetrics services that they wouldn't otherwise have in our community. Because of 340B, our patients can stay close to home and receive exceptional care from leading physicians. 340B is so much more than a drug discount on medications for patients. At CMH, our program is vital for our patients to access the safest, highest quality, and best experience we can offer. We need legislative support to protect the program from attacks that reduce access to 340B medications, decrease payment to 340B pharmacies, and divert savings outside the communities we serve. Safety net hospitals in Missouri need action now. Help us put a stop to the discriminatory practices before they completely erode a program that was put in place to keep our doors open. This program is critical for covered entities to keep us taking care of patients in rural and vulnerable communities across our state. Thank you, and can I answer any questions?
Thank you for your testimony. Questions? Seeing none, thank you. Anybody else testify in favor?
Good morning. Good morning.
morning.
I'm Jake Simmons. I'm the pharmacy business manager for MU Healthcare, University of Missouri Healthcare. I'm speaking in support of House Bill 442. MU Healthcare, you heard a little bit of the background of the 340B program. We're really here I'm here today to speak to the provisions of the 340B statements that protect and prohibit some of the discriminatory practices that we're seeing with pharmacy benefit managers today. MU Healthcare is one of 2 safety net hospitals in the state. We provide services to all Missourians, and this provision really helps to promote our mission. In fiscal year 2021, our community benefit was around $131 million. So when we see discriminatory pricing practices that we're starting to face, it takes away from our ability to provide that benefit to our communities. Some of the examples of things that MU Healthcare has done for the community is we provide prescriptions to low-income patients. We have comprehensive oncology services, women's services, infusion services. All of these things are aided by the 340B program. And part of that as well is allowed us to offset some of the costs of doing care in some of our rural communities. The provisions of this bill would protect us from some of the discriminatory pricing practices that we've seen, which have lowered reimbursement, and we're also seeing increases in cost across the board. So it's making it more difficult to provide services, and we're seeing community hospitals close. A few examples that MU Healthcare has provided over the last few years is we've put community family practice clinics, urgent cares in Mexico and in Boonville, where we saw community hospitals close because of the pressures that we're seeing. So we're very much in support of this bill and the protections that it imposes on reimbursement so that we don't lose the benefit of the program. So really appreciate your time today and my opportunity to speak in support of this bill.
Thank you for your testimony. Questions? Seeing none. Like I mentioned, we are very short on time. We still have 4 more bills to do, so please be brief.
Mr. Chairman, members of the committee, Kelly Gillespie with the Missouri Biotechnology Association, here to go on record in support and specifically in the territory of the copay accumulator provisions of the bill that increase access for patients.
Thank you. Questions? No? Thanks, Kelly. Anybody else in favor?
Mr. Chairman, David Winton here on behalf of Cox Health, BJC Healthcare, and Burrell Behavioral. I want to go on record in support of the legislation. Just point out, we did add language in the House version that would only have the provisions of the copay accumulator apply to any drugs that do not have a generic equivalent. So only drugs that only have one brand would be involved in this bill. So just wanted to make sure we pointed that out.
Thank you. Questions? Anybody else in favor? Testimony in opposition?
Morning, Mr. Chairman.
Good morning.
Chairman Bernskoetter and members of the committee, thank you for the opportunity to provide testimony to House Bill 442. My name is Sean Stevenson. I'm with the Pharmaceutical Care Management Association, representing the PBM industry in the country. PCMA is the National Trade Association of Pharmacy Benefit Managers, which administers prescription drug plans for more than 275 million Americans with health care coverage provided through employers, health insurance plans, labor unions, Medicaid, Medicare, federal employee health benefit programs, and other public programs. There's one takeaway I want you to remember from my testimony today. It is this: the PBM industry is the only stakeholder in the drug supply chain dedicated to seeking lower costs. The core mission of PBMs is to reduce prescription drug costs for health plan sponsors so that consumers have affordable access to the needed prescription drugs. PBMs offer a variety of services to their health plan sponsor clients and patients that improve prescription adherence, reduce medication errors, and manage drug costs. One of those tools that PBMs use to keep costs down are copay accumulator programs. Copay accumulator programs are health plan programs designed to thwart drug manufacturers' efforts to force employer unions and public programs to pay for expensive, unnecessary brand medications through the use of a copay coupon. Accumulators typically disallow the counting of the manufacturer coupons toward the patient's out-of-pocket maximum and deductible because the patient hasn't actually incurred the cost. This ensures that the patient has the incentive to use the plan formulary and that the plan functions as it was designed. PCMA does not oppose true means-tested patient assistance programs that help individuals afford their prescription drugs. There's an important difference between means-tested patient assistance programs and copay coupons, which are targeted toward individuals with health insurance. The unfettered price increases of prescription drugs put patients at risk and health plan sponsors in the difficult position of either having to cut benefits or increase premiums, copays, and deductibles. While health plans pay the vast amount of their members' prescription drug costs, Drug manufacturer price increases have forced health plans to create new benefit designs that keep monthly premiums as low as possible, but require some members to shoulder more of the cost before their deductible is met. Drug manufacturers encourage patients to disregard formularies and the lower cost alternative by offering coupons to help patients cover that higher cost. This ultimately steers patients away from the cheaper alternatives and towards more expensive brand drugs with higher cost-sharing obligations, completely undermining the formulary offered by a plan sponsor. Here are some quick facts I just want to talk to you about manufacturer coupons. The price for drugs with manufacturer coupons increased faster, nearly 12 to 13% per year, compared to non-coupon drugs, which is between 7 and 8% per year. If Medicare's ban on coupons were not enforced, the cost of the program would increase $48 billion over the next 10 years. And again, Medicare does not allow copay coupons. Coupons were responsible for a $32 billion increase in spending on prescription drugs for commercial plans. For $1 million in manufacturer coupons for brand name drugs, manufacturers reap more than $20 million in profits. By definition, copay coupons target only those who already have prescription drug coverage. Copay coupons are not means tested or designed to help poor or the uninsured. Considered illegal kickbacks in the federal health program, copay coupons are still permitted in the commercial market. Coupons only reduce short-term costs. Coupons are temporary. The individual patient likely pays more when the coupon goes away instead of being started on the formulary drug from the start. It is the manufacturer who benefits by forcing the plan to pay for the more expensive drug. If drug companies are concerned about patients accessing medications, they should simply lower their prices. Yet drug makers have determined it is more profitable to increase copay assistance rather than making their prescription medications more affordable. The simplest, most effective way to reduce patient costs on drugs is for the manufacturers to drop the list price of their drug. As I stated before, please consider the impact this legislation could have on employers who provide benefits to their employees. Legislative ideas that continue to raise the cost of prescription drug coverage will inevitably cause more and more employers to reevaluate the affordability of providing this coverage for their employees. Finally, I'd like to talk about just the 340B portion of this bill. 340B status applies to entity. The 340B program is designed to provide discounts for 340B entities, typically qualifying community health centers, health systems, and hospitals so that they can stretch their resources and offer services to low-income and uninsured populations. Cost sharing for people with health insurance is not linked to 340B status of the entity that treats them or the pharmacy that dispenses their drug. Notifying plans or PBMs when a cure was obtained via the 340B discount program is required in government programs such as Medicaid. Medicaid programs generally require claim modifiers on 340B claims, which identify those claims as 340B and prevent duplicative discounts. Providing the claim modifier will ensure that rebates are credited to the appropriate plan and help 340B practices align with the congressional intent. Chairman and member of the committee, thank you for the opportunity to testify to you today, and I'll be happy to answer any questions.
Questions? Senator Bratton, go ahead.
So I guess by your testimony on the coupon aspect, so it's basically what you're testifying is that it's just a way to get people onto their particular drug, and then the coupon goes away, and then the crazy high cost of the name brand, I guess, continues.
Correct. Absolutely correct.
Okay. I guess is there a way to, I guess, control what they
The list price of drugs is exclusively made by the manufacturer of the drug. If you're a drug manufacturer center and you come up with a cure and a product, you get to determine the list price. If you think that's $5,000 or $5 million, that's your determination at the end of the day.
Okay. Do you have any data on, I guess, profit margin or anything of per prescription or whatnot?
I can provide you with that, but just as an example, there was a drug manufacturer recently said that they're going to drop their list price of insulin by 75%. So they had that kind of margin to reduce the list price of that drug and still be profitable and make a margin even after reducing costs by 75%. So I can get data on specific drugs if you like, though, sure.
Okay. Yeah, because the insulin is actually one that I was going to ask on, because I I know I've seen reports like when they invented it, he didn't even do a patent so that people weren't able to make profit off of it, so it helped people. But I get people also invest lots of money to ensure for this innovation to occur, that they have to recoup that. So I'm not demonizing anyone for trying to recoup any sort of innovation. So, but yeah, if you could give me some information, I'd appreciate it. Thank you.
Any other questions? Seeing none, thank you. Anybody else testify in opposition?
Mr. Chairman, Shannon Cooper today representing Blue Cross and Blue Shield of Kansas City and America's Health Insurance Plans, and I'm watching my watch, and there's no way I will get done with my testimony in the next 4 minutes, but I'm going to give it my best shot. I'd planned to direct most of my comments to the coupon issue of this bill, but after all the mistruths that we're told about the 340B, I'll probably switch over and share that. I just a couple things on the coupon issue. This is illegal at the federal level. You cannot do this. It is expressly prohibited under the anti-kickback clauses. And the reason that is done is because the federal government figured out that these kinds of scams just insulate a very small percent of the people in the insurance world from the high cost of these specialty drugs, and it puts the burden of paying for those upon everybody else in those plans. So for once, I would say the federal government has done something right and recognize that these kinds of programs, they're not about the patient. They're all about shielding the price of these specialty drugs, and in doing so, the rest of us on those plans have to pick up those costs through higher premiums. The fallacy that somehow the insurance companies pocket the money off those coupons, we don't get those coupons back. Our employer organizations that purchase our plans for their employees, they don't want these types of programs because they recognize the fact that if somebody else is picking up the tab for everything, when you hit that out-of-pocket max that's paid for by somebody else, there is no incentive whatsoever for you to be prudent about your health care cost choices. That is a reality, and that is why we're opposed to this. I'll switch over to 340B program, a great program, without a doubt, that was started back in 1992 with the sole purpose of helping safety net facilities, mainly in rural areas, combat the fact that there was a lot of uninsured people out there that could not afford prescription drugs. The federal government created a program that forced drug manufacturers to provide certain pharmaceuticals to these safety net hospitals at an extremely low cost, with the agreement and the understanding that when they sold those, if there was any profit, that profit would be spent back in that community to help the uninsured have better health outcomes. You fast forward to today, and a simple internet search will reveal the outrageous activities around 340B and how large hospital chains have gone out, purchased a small FQHC, and funneled millions and sometimes billions of dollars worth of profits from those drugs, taking them from the rural community, putting them into a large commercial market and selling this for these huge profits. Those profits aren't going back to those rural hospitals. In fact, this is so outrageous, Al Sharpton has joined us in bringing this to light in Virginia, where a Richmond hospital made millions by acquiring a small FQHC in a predominantly black community, siphoning all those drugs out of there and selling them in the Richmond area at a huge profit. 2 weeks ago, we met with Senator Brown to discuss Senate Bill 26 in an attempt to find a compromise on some 340B language. But at the end of the day, what happened in that meeting, and I think it is clear, was that the frustration of certain folks in the rural areas recognizing the fact that Medicaid and Medicare does not cover their costs. That is not an insurance industry's problem. We don't set those reimbursement rates. But the statement was made is, we don't get enough money from the state or federal government to pay for these patients. The only pot of money we have is to go to you folks and overcharge your consumers, because that's the only way we can make money. And that is just not right. They are trying to take advantage of your constituents, folks that are doing the right thing, employers that are doing the right thing, having insurance, but yet they want to come back and charge us more because they're not going out and doing an effective job lobbying you and the federal government to get those reimbursement rates up higher. So this battle is going to continue. I would agree with some of the previous supporters of this bill that most of these issues need to be dealt with at the federal level. The state level is not the right place to do it. But I want to leave you with the thought that employers, large and small alike, oppose this language because they realize what it does to their plans. And whether it's the public schools in your district that buy a large group, whether it's the carpenters union that it self-insures their members, legislation like this does nothing but drive up the costs for those folks. And with that, Mr. Chairman, I hear the bell ring, and I'll be happy to answer any questions.
Any questions? Seeing none, thank you.
Thank you.
Anybody else testify in opposition? Seeing none. Oh, you're going to have to be quicker.
Chairman Bernskoetter, members of the committee, Michael Henderson for the Missouri Insurance Coalition in opposition to this bill. Mr. Cooper summed up all the points I wanted to make, so happy to answer any questions.
Questions?
Thank you.
Seeing none, thank you. Anybody else testify?
Mr. Chairman, members of the committee, I'm Chris Long, a registered lobbyist with the St. Louis Area Business Health Coalition. We're a coalition of 60 major employers in the St. Louis area. A lot of talk about cost increases. When there's cost increases in the healthcare system, it winds up on our front porch. We're the ones that pay the bills. We're the source of payment. And when our costs go up, exponentially, we've got to make some tough decisions. Those tough decisions include passing on more of the cost to our employees, which we don't want to do, reducing benefits, which we don't want to do. There's not a good choice for us, but it's a difficult choice, but it's yet one we have to make, and it's being made every day because of the increase in healthcare costs. We believe 442 will exponentially increase our healthcare costs, and because of that, we ask you to oppose the bill.
Thank you. Anybody questions? Seeing none. Anybody else testify in opposition? Anybody for informational purposes only? That concludes the hearing on House Bill 442. The bell's ringing, but I would like to exec on a couple of bills real quick, and then I have a second. But I wanted to, we will come back. We're just going to gavel in and gavel out in the Senate, and then I'm told we can have this room again afterwards, so we will come back and resume the hearing since we weren't able to get through all the bills. I have a second to go in executive session. All those in favor say aye. Aye. All those opposed say no. We're in executive session. House Bill 802 is Representative Dinkins' bill dealing with conveyance of property. I move that House Bill 802 be brought before the committee. Second. I have a second. All those in favor say aye. Aye. The bill is for the committee. I have a committee substitute. It ends in .004C. I've added some. The substitute includes Senator Roberts' conveyance from SB12 and 612, and Senator Brown's conveyance from SB248. They've all been heard in the committee. It also has a conveyance for the National Guard. I move that Senate Committee substitute for House Bill 802 be adopted. I have a second. Is there any discussion?
It was email. I've got a hard copy.
Any discussion on the substitute? There's all bill. It's all conveyances we've heard before. You okay? All right. All those. I move the Senate Committee substitute for House Bill 802 be adopted. I have a second. All those in favor say aye. All those opposed say no. I move that Senate Committee substitute for House Bill 802 be voted do pass. Right. Second. Matt, please call the roll to vote Senate Committee substitute for House Bill 802 out of committee do pass.
Senate Committee substitute for House Bill 802, Senators Bernskoetter.
Aye.
Aye. Searpoy. Aye. Beck. Aye. Black. Aye. Bratton. Aye. 5-0.
By your vote of 5-0, the motion carries. I also have House Bill 447, it's adult high schools. It's Representative Davidson's bill. We voted the Senate equivalent out, do pass from this committee. I move that House Bill 447 be brought for the committee. I have a second. All those in favor say aye. All those opposed say no. The bill is for the committee. I move that House Bill 447 be voted out of committee, do pass. Second. I have a second. Matt, please call the roll to vote out House Bill 447 out of committee, do pass.
House Bill 447, Senators Bernskoetter.
Aye.
Aye. Searpoy. Aye. Beck. Aye. Black. Aye. Bratton. Aye. 5-0.
By your vote of 5-0, the motion carries. I move we exit executive session. Do I have a second? All in favor say aye. All those opposed say no. We're out of executive session, and we are in recess. We will be here as soon as we get done on the Senate side.
Did you play yesterday? No. I had a hearing at 2. I was at Commerce for
Thank you, Chairman. Members of the committee, allow me to present Senate Bill 706. I do have a substitute that was distributed, and so I'm presenting off that sub. What this is dealing with is when you have a city that annexes new territory, and then there's a fire district within that city will have to, in some instances, would have to pay that fire district. In some instances, it's almost like they're paying twice for the service. And so this is trying to look for solutions. It's a complicated issue. In the substitute, what we do is it kind of allows some of the commercial property to stay or get annexed by the fire district, and then more of the residential area would go into, would be done by the city. So it's designed to, this compromise was actually brought forward by the city of Hazelwood and the fire district in that area. And so I'm willing to take any questions.
Thank you, Senator. Questions? Senator Bratton, go ahead.
Well, I've had to actually deal with this with a district or a subdivision within my district where they overlapped. It was kind of a recording issue to where, they weren't removed and they were being charged twice for fire service. So I get the conundrum that people are in and having to pay twice, and there definitely needs to be some sort of mechanism to remedy this situation, because it's a huge disservice to people paying twice for something that they shouldn't be paying for. So I'm happy to offline kind of explain what I had to do and potential solutions as well. So
Any questions? Senator Beck, go ahead.
Does this only affect the city of Hazelwood and the Robertson?
The way it's drafted, it does not only affect the city of Hazelwood, but since there is a compromise there, if we have to limit it to Hazelwood, that I think that could be appropriate.
Okay.
But there's definitely, obviously, issues in other areas.
Thank you.
Okay, thank you for your testimony. Anybody to speak in favor, please come forward.
Morning, Mr. Chairman, members of the committee. Thank you very much for an opportunity to speak to this. My name is Matt Zimmerman. I'm the city manager for the city of Hazelwood. We have been working on this issue since 2015. The financial pressures as a result of the state laws that exist today has continued to grow on our community. That's not been a secret. We have made it, we have talked with many members of the legislature over many years about this issue. I think this issue has become well known. We want to thank Senator Koenig for his research into this, his leadership on this issue, because while this issue isn't directly in his district, I think he's come to the same conclusion that some kind of a change is necessary. We continue to work on a bill. We support Senate Bill 706 as written, but we understand that there are concerns in other places, and so that's why we are working on a slight amendment that would limit this only to Hazelwood. This bill would allow us to work directly with the fire district on a solution. It would be only pertain to Robertson Fire Protection District and the city of Hazelwood. It would allow us to annex areas. Our payments, quite frankly, have gone up from $1.5 million to $6.3 million over the last 20 years. That's 10% a year. That is unsustainable for us. It's unsustainable for any organization, quite frankly. And so what we're trying to work with the Robertson Board of Directors, with this revised language that we sent to them yesterday, because we heard the concerns that were out there about expanding this beyond Hazelwood and Robertson. They are supportive of this. They could not come on very short notice to the meeting today. But this bill would allow us then to annex the commercial areas without necessarily, because there are no voters in the commercial area, it clarifies under the state law what happens if it's a 0-0 vote, in essence, and would allow, if there are no voters, allow the city, if the landowners petition and the city agrees and the fire district board agrees, allows that a judge to authorize that annexation because there are no voters. That's basically what this bill does as it's revised. And so it's unique not only to Hazelwood and Robertson, it's unique only that no taxpayers are affected by this, and would allow our payments to go down from roughly $4.5 million a year to $1.5 million a year without reducing any money to the fire districts. We believe that this is a reasonable, rational bill that has been worked out between the parties, and we ask your support. I'll be happy to answer any questions you might have.
Any questions? Senator Breton, go ahead.
So in the event that, say, so in my circumstance, I had a fire district that refused to actually, participate and relinquish the fact that they were double taxing, not providing that service. So I guess if you're having to get all parties to agree, I guess that I could see where that could be a concern, where, whether it's commercial property or whatever, are paying twice. Well, if you're getting money and not providing service, heck, that's money in your pocket to, so that's where I see there could be a potential conflict. If you have to have all parties agree in this, that could be a conundrum where you place a business, or in my case, voters, and constituents, to where they're at odds with one another. And if we make it to where everybody has to be all in line with this before it goes before a court, I could see it could be problematic. So I don't know if
I agree with you, Senator. Thank you very much. I'm sorry, I didn't mean to cut you off. Please finish.
No. I was finished. So I just wanted to.
I agree with you, and to provide a little more history in the interest of time, I was trying to keep this short. It's obvious that a solution is being cried out for. It's obvious that we've never been able to push a solution through since 2015. We sat down then to try and work on some compromise language all last summer at the behest of Senator Williams. We worked very hard to come up with some language we thought would be supportable, which is what ended up being Senate Bill 706, which you've seen a copy of, which would allow the parties to negotiate. We have been told that there's still some opposition to that language unless it's only limited to Hazelwood and Robertson. And because we are working towards a solution that we believe can work, we're willing to limit this, even though your concerns are very valid. The other comment I would make is that the board of the Robertson Fire Protection District was recalled by the voters last year, and the new board has indicated their support towards coming up with an agreement that would allow for the annexation of the commercial property. So in this particular case, we are not envisioning them then saying, no, we are not going to approve the petition to allow for the annexation of that area without any voters.
Any questions? Seeing none, thank you.
Thank you.
Anybody else testify in favor, please come forward. Anybody testify in opposition?
Good morning, and thank you for the opportunity to speak in front of you this morning. My name is Jason Hovelman, and I'm the fire chief with the Florissant Valley Fire Protection District. We also had joined the city of Hazelwood, and were part of that annexation that created 72418 back in 1994. We came here originally to testify in opposition of the original language, but I do have a few bullet points that I was able to quickly get from our attorney Chuck Hatfield in reference to the substitute language. And just quickly is that we want a collaborative effort that could make sure that we can answer unintended consequences and that there's not an impact that we don't see as quickly as this is moving that could challenge or impact our districts. But the way the legislation's been explained to us and how it is drafted do not match. In other words, we can't support legislation that is ambiguous, and we're unsure of what those outcomes might be, and if it's going to have conflicts with 321, 310 that could impact even a larger demographic of fire protection districts down the road. The second note is that no one has been able to explain the impact of this legislation to the Florissant Valley Fire Protection District, and we can't support anything that even has the potential to have a negative impact on our fire protection district. And then on the technical side, the legislation is drafted into the wrong section, according to our attorneys, so it appears, and there's no guidance in the legislative language on how this amendment interacts with existing law. We're open to having a collaborative effort. We were not brought into the fold on this legislation, even though it could impact us, since we do fall under 72418. But with as quickly as this legislation's been proposed, we just don't have enough answers from our legal counsel to ensure it doesn't negatively impact our ability to provide services to our residents in our fire district.
Thank you for your testimony. Senator Bratton, go ahead.
Well, I guess with the ambiguity in this, I guess, wouldn't it really fall down to the fact that, you know, who is and who isn't going to be providing that fire service, protection service? I guess because in my case, where we had a fire protection service that because of the way everything unfolded, they were able to charge and levy tax on people, but there was no way in Hades they could actually provide that service, while, you know, another fire district was providing that service. And so I guess to me, it is a pretty clear cut, you know, are you or aren't you going to be providing that service?
Currently we do, and currently
Okay.
the taxpayers in that service area that was annexed in 1994 do not pay any taxes to us. And we do provide that service. I think the ambiguity that our legal counsel presented to us is it's very similar language that already exists in 321, 310. And if the language has any changes. The other thing that's been discussed, but is obviously, you know, just discussion at this point, is if these things do take place without us having the ability to vet it and we act on the new legislation, are we going to get sued due to the businesses that are annexed under this bill decide that they didn't have representation and are now paying different tax to the fire district, even though they're still receiving services? Are there constitutional problems? And that's what our attorney's been trying to convey to us and try to figure out, but it's just been short notice.
Okay, so during the annexation process, I guess, are these things not brought to light in the public hearings and so on and so forth?
It's not clear in the language that they're proposing. Well, Mr. Zimmerman did outline how it goes to the court, but the sense that we have is that even though there's no voters, which would allow the judge to unilaterally allow the board to annex those businesses in, does it open us up for lawsuits as a fire district that are expensive and ongoing and could result in a number of things and that could be impacted in 72418, which allows that agreement to exist and allows us to still protect the service area that we originally had before 1994.
Okay, all right, thank you.
Senator Beck, go ahead.
Yep. Good morning.
Good morning.
So there was an interim committee in the Senate that was put together to address the fire districts last year, and which I thought was a great idea. Now, I wish I would have been involved in it, since I do have one of the areas that's affected by this, but I was not on the committee. However, the committee never met. Was there input from you?
We did have a meeting. I think the first meeting that we had with Senator Williams, I think, who was the chair of that committee, was in October or November. I can't remember the exact time, but in the fall, and all the stakeholders were present. The Robertson board at that time, which is no longer the board, but Robertson was represented, the Florissant Valley Fire Protection District was represented, the City of Hazelwood was represented, and it was kind of a brainstorming session. And it is a delicate and complicated issue in some ways, and nothing sustainable came out of that meeting.
Yeah. Was it an open meeting? Was it?
It was a
or
private gathering.
Just a private gathering? So it really had no connection to the committee, I guess?
It did not.
Okay.
I think it was a listening session for Senator Williams to
Okay.
hear the concerns from all the stakeholders.
And I'm fine with that, because I've had private meetings with the parties that are involved, too. I was just curious about that, so thank you.
You're welcome.
Okay, thank you for your testimony. Anybody else in opposition, please come forward.
Good morning.
Good morning.
My name is Jeff Sadler. I'm the chief of the West County EMS and Fire Protection District in St. Louis County, and I probably would be the most expeditious witness you have today, I guess. I will echo what Chief Coleman said. I thought he said it better than I could have. We are empathetic to the situation that this bill is attempting to address, but I think we were unaware of it until just within the last couple of weeks. We haven't been involved with any of the discussions, and it does impact us as well, potentially impact us as well. There's are some significant concerns. We're happy to sit down and work to get something that works for the group. But in the absence of that, we are opposed to it.
Thank you. Questions? Thank you for your testimony. Anybody else in opposition?
Good morning. First time for me. My name is Nick Foz. I'm the chief of the Afton Fire Protection District. And I originally came to speak on a separate bill, but I would just like to voice a little bit of the concern I had from the preliminary discussion that we just had this morning. So if it's just Hazelwood and just Robertson, obviously it would not affect us. But if it was to come to where it affected our relationship with the city of Crestwood, we don't have a tremendous amount of commercial development, and my concern would be if they were taxed twice as much or paid the city of Crestwood tax and tax to the Afton Fire Protection District. One, what would happen the first time they get that tax? And if they were to challenge that or not be happy with that, would that be the fire district defending that? And the other real concern I would have is they could just go right down the street. I mean, how would that encourage business to come to Afton if that section or area was taxed in that specific method? And what would it entice people that are currently in that area to leave, especially in Afton, South County? We're really close together. They wouldn't have to go far to get out of that predicament. So the way it's currently written, we would be opposed to it. We understand the dilemma that they're going up in North County, but that would be my concerns. And thank you so much for
Thank
your
you.
time.
Questions? Seeing none, thank you. Anybody else in opposition? Anybody for informational purposes? That concludes the hearing on Senator Koenig's bill 706. Senator Bratton, will you take over?
Right. The next bill up will be Senator Bernskoetter's Senate Bill 570. Proceed when you're ready, Senator.
Thank you. Thank you, Mr. Chairman. Members of the committee, 570 extends the effective date for revised Missouri Pesticide Use Acts from 2024 to 2025. We passed legislation amending the Missouri Pesticide Use Act, which updated sections pertaining to pesticide training and certification, and we don't want to rush the final product, so we're just extending it out for another year. And I'd be happy to answer any questions.
Any questions? See none. Anyone to testify in support of Senate Bill 570, please come forward. Please remember to fill out a witness form.
Chairman and members of the committee, my name is Danielle High with the Missouri Department of Agriculture. We'd like to go on record in support of Senate Bill 570.
As Senator Bernskoetter said, this would allow us to extend the effective date of the Missouri Pesticide Use Act from January 1 of 2024 to January 1 of 2025. Recently, it was decided that the implementation date should be pushed back a year, as it has had a longer than anticipated timeline. The university has not been able to get their manuals reviewed and approved from EPA due to things such as COVID, being out of the office. So for that reason, all parties involved decided that the implementation date should be pushed back a year. As Senator also said, we don't want to rush final product for our farmers and applicators. With that, I'd be happy to answer any questions.
Questions? See none. Thank you for your testimony. Anyone else to testify in support, please come forward.
Chairman, members of the committee, Casey Wasser, represent the Missouri Soybean Association today. We'd like to go on record in support of the legislation.
Question? See none.
Thank
you for your testimony. Anyone else to testify in support? Please, everyone, remember to fill out a witness form.
Mr. Chairman, members of the committee, Jacob Knable with Missouri Corn Growers Association would like to go on the record in support of the legislation and also thank the bill sponsor for bringing it forward.
Questions? Seeing none. Anyone else? All right, please come forward.
All right. Ben Travelis, Missouri Farm Bureau, here we go on record in support.
All right, he's good on it. All right. Anyone else to testify in support? See none. Anyone to testify in opposition? Informational purposes only. See none. That concludes the hearing on Senate Bill 570. Okay. Next, we'll move to Senate Bill 688 by Senator Bernskoetter. Please begin when you're ready.
Thank you, Mr. Chairman. Members of the committee, the bill would move the fire protection services for the city of Crestwood entirely into the Crestwood Fire Department. At one time, it wasn't feasible for Crestwood to provide fire services for their entire city, but now Crestwood is able to do so. So that's the emphasis of Senate Bill 688. I'd be happy to answer any questions.
Question? See none. Anyone to testify in support, please come forward. Again, please remember to fill out witness forms.
Thank you. Good morning, and thanks for taking the time to consider this legislation. My name is Chris Simpson. I've been the city administrator for the city of Crestwood for the past 7 years. I want to thank Senator Bernskoetter for his support of the legislation. I want to thank Senator Beck as well for representing the city and his efforts in the past to kind of help us find a solution to this situation. As you heard with the city of Hazelwood, it's a tricky situation. It's complicated. I think our set of circumstances is a lot less complicated than theirs, and we've proposed a cleaner solution, in my opinion. Currently, the residents in the city of Crestwood receive fire and EMS service from 2 different entities depending on where they live. 85% of Crestwood residents receive fire and EMS services from the city of Crestwood. 15% of our residents living in an annexed area receive fire and EMS services from the Afton Fire Protection District. This arrangement came about in 1997 when voters approved Crestwood's annexation of a portion of unincorporated St. Louis County that also happened to be within the Afton Fire District. It's not a large area, but our payment to Afton has become enormous over time by comparison to the size of the area. Typically, when an annexation like this occurs in any other county in the state of Missouri, there's a transition period whereby fire and EMS service transfers from the district to the municipality. In St. Louis County, however, a special law was enacted that requires the municipality to pay the fire district to continue providing fire and EMS services. Like a lot of legislation, the law of unintended consequences applies. Sometimes circumstances change, and that requires re-examination. But at the time when this was implemented, the arrangement arguably made sense. There were railroad tracks that cut through Crestwood that would have slowed emergency response to the area whenever a train was passing, and also at the time the payment was reasonable. But now here we are 25 years later, and the arrangement no longer makes sense from a financial standpoint, a good government standpoint, or a public safety standpoint, in our opinion. In the early 2000s, those railroad tracks were removed and replaced with a trail, eliminating that obstacle. The payment, which was reasonable in 1997, has become exorbitant due to multiple tax increases by Afton. In 2012, they increased their property taxes by 26 cents per $100 of assessed value. 5 years after that, they increased them again by another 25 cents. And 5 years after that, in 2022, Afton increased their taxes a third time by another 10 cents. As a result, our payment grew by over 300%, from about $150,000 to $620,000 last year. It's more than double the rate of inflation over that period of time. And between 1997 and 2022, Crestwood taxpayers have paid Afton over $6 million for fire services that could have been provided by the city at no cost. There's no expiration date on this payment, and there's no ceiling on the cost. We tried negotiating with Afton multiple times over the years with no results. We've offered many compromise proposals, but each one's been rejected. We took our case to the Missouri Supreme Court, challenging the lawmaking requiring us to make this payment. And the court's decision was to support the law but put the matter back in the hands of the state legislature, saying that you all have the power to change the circumstances. Currently, Crestwood provides all municipal services to the annexed area except for fire service. Our police officers patrol the streets. Our public works department maintains the streets and plows the snow. Our residents call us first for service, and they expect us to be the one providing all of municipal services for the city. We have to forward them on to Afton whenever they call on a fire-related matter. The only aspect we do not provide currently is fire service, but our department stands ready and is willing and capable of doing so. We could take over fire service to this area with no additional employees or equipment, no additional facilities, and we can provide the same or better fire and EMS service that the residents in this small area currently receive. We have a great working relationship with Afton. We have and will continue to provide and receive mutual aid on calls. Crestwood has nothing against the districts or its first responders, but the present situation is wasteful and inefficient. Our residents love their fire department, but as a fiscally responsible local government, we want to provide our residents with the highest level service at the lowest possible cost. Passing this legislation would allow us to do so. Thank you. I can take any questions.
Thank you for your testimony. Any questions? Senator Beck.
Just to be clear, I do represent Crestwood and Afton, correct?
That's right.
Okay, thank you.
Thank you.
Thank you, Senator. Thank you for your testimony. Anyone else to testify in support? We do have one more bill still to hear, and we only have 7 minutes, and we have another committee. So if we could keep our testimony very concise and clear.
Morning, Mr. Chairman, Senator. My name is Grant Mabey, Mayor of the City of Crestwood. I could talk for a couple hours in support of this bill, but I'll try to make it in a minute given the time constraints. I appreciate Senator Bernskoetter for his sponsorship. Senator Beck, I appreciate everything you've done for Crestwood and your service to our city and everything you've helped on over the years. And certainly appreciate everything you've done to try to facilitate discussions between the Afton Fire Protection District and the City of Crestwood. Certainly not for lack of trying. We have met for years with Afton trying to find a compromise in this situation, and those efforts have really been exhausted, and the courts told us this was our recourse. Over the years, the cities of Lee Summit, DeSoto, Springfield, all around the state have annexed areas, and the municipality takes over, and there's a pay-down period, and that pay-down period is 5 years. And here we've been paying for 26 years, 21 years longer than anyone else, and there's no end in sight. This is the highest legislative priority of the City of Crestwood. Right now, it's a massive financial hardship for the city to make this payment. We could help our taxpayers and our firefighters. We're proud of our firefighters. We have quality IAFF firefighters, and they work in tandem with all of our mutual aid departments around us. But if Afton's a growth area, they have a large subdivision going in at the Resurrection Cemetery. They're going to be adding a couple hundred homes. And with that growth, if there's another tax increase down the road and we get hit again with another bill, it's going to be devastating for the city. It's just not something we can sustain. So I think this legislation makes sense from a fiscal responsibility standpoint and from a public safety standpoint. I live in the annexed area as the mayor. I live in the dead center of it, and it's 7947 Camelot Lane, and the nearest Afton fire station is 2.3 miles away. And the Crestwood Fire Department is a half mile closer to my house at 1.8 miles. And our fire chief wanted to be here today. He regrets he couldn't. He's ill. But we believe our response times would probably be in the nature of 30, 45 seconds quicker to this area. And so you do have a speed component as well. Okay. I'd be happy to answer any questions.
Thank you for your testimony. Questions? See none. Thank you very much.
Thank you for your time.
Anyone else to testify ever so briefly in support? Opposition? And again, we're down to the wire, so please make it very, very brief.
I will.
Again, my name is Nick Foz. I'm the chief of the Afton Fire Protection District, and I am here to speak against Senate Bill 688. To be brief, off of my notes, some of the things that you were just told here were the exact same things said to the Missouri Supreme Court. They did rule in our favor. The implication that they pushed this back to you for reconsideration, the court just ruled that we were correct. The district spent $200,000 in legal fees defending this. I just want to give you a brief history, and then I would like to address the effect of the fire district. Our residents didn't ask for this. Before it passed in the 90s, it failed. And after it failed, then the city of Crestwood went to the legislature and they changed the rules to where Afton would provide the fire protection. And after they did that, it passed. We've done nothing but play by the rules. We've done nothing to change anything. And the only concern that I would ask the senator to consider is what happens to the Afton Fire District when that area is gone. We would lose 9% of our revenue, but we would still need the 2 fire engines and the 2 ambulances that work there. Just because we lost the annex area does not mean that we could just close a firehouse. This bill would be the demise of the Afton Fire District. It would be a slow strangulation financially. And again, as far as his response times, that simply is not true. He may live in a corner where he is a little closer, but there's plenty of areas that we actually provide better service than the city does. But I don't want to get into that. They have great firefighters there, and I appreciate the city of Crestwood.
All right. Thank you for your testimony. Any questions? See none. Anyone to testify in opposition? We have like 1 minute. See none. Informational purposes? See none. Senator, closing remarks?
Nope.
All right. So that concludes the hearing on Senate Bill 688. We will move to the next hearing, Senate Bill 630.
Senate Bill 630, this bill allows certain government records to be closed if releasing them would endanger the health or safety of individuals or the general public.
All right. Seeing no questions to testify in support. Please
Chairman,
be.
members of the committee, Lieutenant Colin Stosper of the State Patrol, testifying in support. This will protect our educational institutions surrounding our anonymous tip hotlines.
Okay.
With that, I'll take any questions.
Perfect.
Thank you, Senator.
Seeing none. Anyone else to testify in support?
Mr. Chairman, members of the committee, Michael Grote appearing on behalf of Missouri School Boards Association. We also support this legislation. It's no different than the other things we've done to protect school resource plans, safety plans, those types of things to make sure that our students are safe, so we appreciate your support.
Perfect. Thank you. Anyone else testify in support? Testify in opposition? Informational purposes? See none. That concludes the hearing. Yeah, thank you. Second.
Opposed, say no.